Hello, I am Dr. Adriana Potter. On the Benefit Yourself today, we're going to talk about kinesiotape and how that is very important in using in combination with doing exercises and also for pain management. Specifically today, I'm going to teach two methods of tape, one for swelling and one for patella tracking for knee issues, which it kind of complements a little bit the previous video that I did on Let's Get Physical series. And so on the today's series is going to be the kinesiotape, okay? Just in plain terms, I'm not going to go very specific, but the kinesiotape principle is actually just trying to help to improve the blood flow and either facilitate or inhibit the muscle. The two that I want to do is for facilitation of movement, okay? And in the swelling. For the swelling, you can buy pre-cut tape or you can buy a roll of tape. I like the Kinesiotape KT Gold in general, but they are the more expensive one, and I found that different brands are just as good. But for the knee, usually they come in the squares on the back so you can see what's that going in. And we're gonna get about 4 to 5 squares in here and cut that in here. For the swelling, we're gonna use, I always tell people, it look like a jellyfish, and we're gonna cut, I fold it in here because this is gonna be my anchor. And here on the bottom is gonna be my fingers for the swelling drawing it. And you're gonna cut 3 fringes into this area. So, and number 3 and 4 in here, and you cut it. You can buy them pre-cut, and of course you're gonna pay for it. Or you can make your own and then do it. So that's the fingers. Usually we round the edges because it makes sure that it doesn't catch on your clothes and doesn't peel so easily. So I like rounding the edges of the tape, so they kind of make it easier to not peel it so much. And alrighty, so it is the jellyfish fingerling for the swelling, okay? And with the knee bent, so when you're having a lot of swelling on the knee, right, you want to have the knee bent, okay? And you are gonna press it one in this direction and one on the other direction, okay? So you're gonna peel it, the top, that's your anchor, and you're gonna start it, you're gonna finish about the level across the knee area in here, okay? So you're gonna start it in here on the outside, and you're gonna pull one finger in at a time, okay? Pull it here, stretch it, not 100%, just a little bit of the stretching, and put it across the knee. And here. Same thing with the second fingerling. You're gonna slide your finger over it. Number 3 in here, hold at the end, little gentle stretch over the knee joint. And what this is doing is pretty much making the circulation coming upwards towards your leg and away from the knee, okay? So when you look into here, you still have the ability to move your knee, and this is how it will look, the tape. And you can do a second one coming from the inner thigh going across into the area, okay? So just to recap, I cut it about 4 to 5 squares, saving my angle. I like to fold it this way, so when I'm cutting it, make it easier, not so sticky. And you cut it into 4 fringes. And you don't want to put a lot of tension. If you put a lot of tension, what's going to happen, you're going to get very, very itchy. And if it's itchy, you will remove it sooner than you need it to. So you want to make sure that it is just a little bit of tension, not a lot of tension. So less is better. When in doubt, don't put too much, okay? And you make sure that you don't have allergy to Band-Aids. If you have allergy to Band-Aids, this is not good for you, okay? So I'm gonna show it again from the inner thigh, okay? I'm gonna tear at the top, feel my top, that's my anchor. No tension on my anchor. Rub it. Rubbing activates the adhesive and makes it more sticky. Okay, and then I'm going to start with the bottom finger. So if you think about it, just a little bit of tension, but not a lot. Okay, it's about 10 to 15%, and you stretch across the knee. So I'm going to go a little bit lower here. And you don't want to be pulling from the skin, because once you stick to it and you try to remove it, what's going to happen is that the adhesive is going to loosen up, and you're going to lose the ability to draw that fluid in here. And the last one into there. There's no right or wrong in the direction as long as they are going upwards. And if you form wrinkles like this, you did the right amount of tension. If it doesn't, you put too much tension. Okay, so that it is the Kinesiotape for swelling across the knee area, and you can do similarly to your ankle area as well. Okay, a little trick that I do so this doesn't keep catching on your clothes, I cut a little 3 squares around my edges in here so it doesn't catch on my clothes, doesn't peel it off. And you can keep this tape for about 5 days. And once it start rolling up of the skin, it's good to come off. But you see these fingerlings, if I don't want them to come off and get caught on my clothes, I can kind of get this guy, cut it right in the middle like a Band-Aid. I tore in the middle. I just kind of held like this and tore and open like a Band-Aid. Stretch it, not too much. This is 100%, we got about 50%. Put it across those fingerlings and peel it over. Okay, that way it secures my fingers here on the bottom so they don't come off. And you wear it for about 5 days. If it happens that you want to remove sooner, you can use some rubbing alcohol, and it will help to make the adhesive to come off more easily or go be gone. If you wanted to keep it longer and you like the way it feels, because it's like almost like a hugging, excuse me, hugging feeling, you can, after shower, you can take shower normally, you can blow dry it because that heat activates the adhesive. So you can do the rubbing with your hands, or you can use the blow dryer to keep the adhesive sticking to it. Okay, so that it is the Kinesiotape for the swelling. You can see how it webs. It works well for bruises as well. So if you're having a bruising issue and you want that bruise to come off clear more easily, this is a good tape for that purpose. Okay, so the second one, it is for a kneecap, to make the kneecap track immediately. So if you're having knee pain when you're bending it, or you had a surgery to do a retinaculum release on the lateral, usually is more often than the medial, or you're having patellofemoral syndrome, or any joint pain in general, or pain with bending, you want to be doing this tape. Okay, this is just doing a tracking assistance, a mechanical assistance. So we're going to do about 3.5 squares, and you will need 2 tapes. Okay, these tapes are going to make a C shape around your knee, and the pre-cuts usually is a little bit too long, and you might have to cut it a little bit shorter. So just cut it shorter. Alrighty, so with the first one, the knee bent, okay, you're gonna tear in the middle, okay, you see the kneecap in here, so you're gonna be kind of keeping the knee slightly bent so you can actually see it. With the knee slightly bent, right? Not all the way, because you want the kneecap to be in that center space. So you can see in here, okay? And you're gonna get this. Now, this is 100% correction, stretch. We wanna put it almost like it's about 75, okay? So you're gonna put it in the center of the knee, on the edge of the kneecap. You're gonna pull it here and curve it that way. And you're gonna peel it, the anchors with no tension. No tension in this anchor, just peeling over the skin. And you rub it to activate the elastic, the adhesive. And you go into your second one, okay? Same thing. Tear in the middle, all right? Open like the Band-Aid. Get your anchors on the side. Stretch it, not 175%. Put it on the other side of the kneecap, here. Curve towards that way, all right? So stretch it here, and then you peel it. This one, same thing here, peel it that way. So that is happening. You can see my kneecap is aiming to stay in the center. You can see the wrinkles pulling there, but it has enough room for me to do it, and keeping the kneecap into that center. It will help with the pain, and it help with facilitating the mechanics of the knee. If you're having a lot of pain across the knee, you can do your other anchor that will help with the knee pain. Again, about 3, tear in the middle, pull it apart, knee fully bent for this one. Put it right in the medial joint line, which is across the kneecap, below here, right in the soft area of the knee here, the meniscus area, and you feel it. And that's it. Those are the 2 tapes that I use quite often for knee swelling, and this is for knee pain and patella tracking. Hopefully you liked the video on the Kinesiotape. Those are the 2 techniques that I use often in the clinic. And enjoy it, use it as appropriate. If you get too itchy, you put too much tension, keep it for about 5 days, and then try to use with exercises. This is not substituting for any of the medical advices or your physical therapy recommendation. It's just reinforcing the information that you get from your physical therapist and assisting you in managing some of the swelling and pain you have in the knees. Thank you for watching. Don't forget to subscribe and press the bell button for the next videos. Bye.